Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. Let's talk about VA's community care and how you could qualify for it. Now, there is a list of different ways in which a veteran can get care in the community. Now, one of those ways is not, I just don't like my VA medical center, and so I don't want to go there. That's not really a way to get community care. So let's read through the ways and the options you have for community care. Community care has been around for a little while. Version of it first started during Obama, then it got bolstered up and really kind of codified with the first Trump administration. And it's basically been the same, although there has been rumors, and I can't validate, I can't confirm nor deny whether or not they're true, but that there has been efforts from the VA to really pull back on allowing community care. Now, again, it's written down here and it shows exactly how you can get community care established for yourself. And, you know, this, again, really got codified with the Mission Act stuff. So let's jump into it here. Hit the thumbs up for me, subscribe, share with a friend, all that good stuff. I really appreciate it. The two asks are really, look, hit the thumbs up and let the video run. That's what puts this in the hands of those that need it. You might not care about community care. You may have a fantastic VA. You love your doctor. You love the staff. Everything's great. They walk in and they say they're happy to see you, right? Others may need it, and this is what we need to do, is to pass this information on. If you want to support the channel in other ways, consider being a member. Thank you so much to all you members. I do my best to get back to you in the comments. You can be a member by going to the homepage. You'll see highlighted members there and a join button. Thank you. All right, so let's jump into this. Eligibility for community care outside of VA. As a veteran, you may be eligible to get care outside of VA. This means that the VA will pay the cost of your care from a healthcare provider in the VA's community care network. Keep going on here with me and I will spell it out for you. Eligibility requirements is where we're going to start. This is actually on the VA's website. You can find it too. After about 43 Google searches, it should show up. All right, so eligibility requirements, and I'll try to chime in where I can as I go through this, and we'll put the information in the description below as well. So eligibility requirements: to be eligible for community care, you must meet the requirements listed here. Okay, that's the step one. Okay, it says you must meet two of these requirements. Okay, there's only two listed, 2 bullet points. You, as the veteran, are enrolled in or eligible for VA health care. It's best just to get enrolled. It's the form 1010. And you can get enrolled with the VA. You can go down to your local medical center or clinic and they can help you get enrolled. All right, next one. So that's one. You have to meet both of these. You have to be enrolled or eligible for VA healthcare. And the second thing that has to happen is you have an approval from your VA healthcare team before you get care from a community provider. Okay, except for certain cases like urgent care or emergency care. Okay, so that means that you can't just go on your own. I don't want to go to the VA, so I'm going to go over here. Again, unless it's urgent care or emergency care, and quite frankly, lean toward emergency care if that's the situation. All right, and you must meet at least one of these requirements. Okay, one of these. So far, you have to be enrolled in healthcare or be eligible for healthcare, and your VA healthcare team needs to approve you to go outside of the VA. Again, that's why I say just get enrolled with VA. That's the best way to accomplish that first bullet. Now it says you must meet one of these. So there's a bunch of ors. I'll emphasize the or. You need a service that the VA does not provide at any VA health facility. Or, okay, because it could be any one of these. Or, you live in a state or territory that doesn't have a full service VA health facility. Or, you live in Alaska, Montana, North Dakota, South Dakota, or Wyoming. Or you qualified under the 40-mile distance requirement on June 6th, 2018, and live in a location that would still make you eligible under these requirements. And I'll go a little further into this stuff in a minute. Or the VA can't provide you care that you need within our standards of drive and wait times, which we'll get into that as well. Or you and your VA provider agree that getting care from an in-network community provider is in your best medical interest. Last one here. We, the VA, can't provide the service you need in a way that meets our quality standards. All right. Examples of when you may be eligible for community care. Here are 6 examples of when you may be eligible for community care based on each requirement. All right. Example 1, a service we don't provide. You need dialysis, but we don't provide dialysis at any of our facilities. So you're eligible to get dialysis from an in-network community provider. Example 2, no full-service VA health facility. You live in Alaska, Hawaii, New Hampshire, Guam, America Samoa, the Northern Mariana Islands, or the U.S. Virgin Islands. We don't have a full-service VA health facility in your state or territory, so you're eligible to get care from an in-network community provider. Example 3, qualification under the 40-mile distance requirement. You live in Alaska, Montana, North Dakota, South Dakota, or Wyoming, and you previously qualified under the Veterans Choice Program's 40-mile distance requirement on June 6th, 2018, so you're eligible to get care from an in-network community provider. Example 4, drive and wait time standards. This would probably be the most common situation that people would typically get eligible for, right? Drive and wait time standards for primary care or mental health, okay? Primary care or mental health. You need a primary care or mental health appointment, but we, the VA, can't schedule an appointment for you at a VA health facility that's within a 30-minute average drive from your home. Or we can't schedule an appointment for you within the next 20 days. In each of these cases, you're eligible to get primary or mental health care from an in-network community provider. Okay, so it's either one of those, right? It's an or. So it's either, if it's not within a 30-minute drive, average drive time from your home, or they can't do it within the next 20 days. For specialty care, they bump it down a little bit because it's specialty care. You need an appointment for specialty care, such as cardiology, care for a heart problem. But we can't schedule an appointment for you at a VA health facility that's within a 60-minute average drive from your home. Or we can't schedule an appointment for you within the next 28 days. In each of these cases, you are eligible to get specialty care from an in-network community provider. Example 5, your best medical interest. This is probably one of the underutilized situations, because I think that you as the veteran would need to probably have this conversation, start this conversation with your provider, and I think that we just don't know that this is even a conversation you can have. So let's go on. So example 5, your best medical interest. You have a certain health condition that your VA provider doesn't have experience treating, but you live near an in-network community provider who specializes in this condition. If you and your VA provider agree that it is in your best medical interest to get care from the community provider, you're eligible for community care for this condition. So chances are the VA and the VA providers are probably not searching for experts or specialists in any sort of conditions near the facility or near where you live. You probably need to take that upon yourself to research it, have a conversation, reach out to that specialist, see if they're taking new patients, tell them that you're with the VA, tell them that you've been getting care there, see if it's something that they think that they would be able to do better at, and then have that conversation with your primary care or whoever you're dealing with at the VA and see if they agree that you'd probably be better off to go see that specialist, right? Next one here, example 6, this is the last one, quality standards. You need cardiology care for a heart problem, but we've determined that your local VA health facility doesn't provide cardiology care that meets our quality standards. You may be able to get cardiology care from an in-network community provider. So it's kind of weird because it's almost the same as the last one, right? If it's not meeting their quality of care, then that means that the provider should agree that you would be better off in your best medical interest to go to a specialist outside of the VA, which is this kind of in line with number 5. In any case, that kind of doubled down in my opinion. So with that, I hope that that helps understand community care and how to qualify for it. Thanks so much for watching. I appreciate every single one of you so very much. Have a great one. And remember, if we don't take care of each other, something went wrong.